My name is Kelly Lyons, and the purpose of my PICO question was to find out which medication or combination of medications is more effective for smoking cessation. I hope to find out whether varenicline, which is also known as Chantix, is more effective alone or when it's combined with some sort of nicotine replacement therapy. Smoking is the #1 cause of preventable morbidity and premature death worldwide. 1 billion people in the world are smokers, and 6 million of them die every year because of it. The U.S. alone loses 480,000 people per year to smoking, which adds up to 1 in 5 people. Smoking affects almost every single organ. There are 69 chemicals inside cigarette smoke that have been proven to cause cancer. Research has shown that smoking is the cause of 90% of lung cancer deaths and 80% of COPD deaths. It also causes cardiovascular disease, stroke, and a variety of cancers. If this information isn't enough to make people want to stop smoking, smokers also tend to die 14 years earlier than those who don't smoke. Even though smokers know their habit isn't healthy, it's hard to quit. This is because tobacco contains nicotine. When nicotine is inhaled, it reaches the brain even more quickly than IV medications. People feel a sense of relaxation, stress relief, and elevated mood. However, these feelings go away quickly and withdrawal begins, which starts addiction. More people in the United States are actually addicted to nicotine than any other drug. Since 2002, we've seen a decrease in smokers. There are actually more former smokers than current smokers. Now there are several different medications to help with smoking cessation, both prescription and over-the-counter nicotine replacement therapies and prescription non-nicotine medications. To find the best research on the subject of smoking cessation, I created a critical appraisal of 4 controlled trials. I made sure each one was comparing varenicline to nicotine replacement therapy or a combination of the two. The first trial I looked at was a double-blind randomized controlled trial from South Africa, which had 446 participants. They were split into 2 groups, and for 12 weeks one group received varenicline along with a nicotine patch, and the other received varenicline along with a placebo patch. At each follow-up date, the researchers asked about nicotine use, withdrawal symptoms, and also checked for exhaled carbon monoxide measurements of less than 10. As for the results, at both the 12 and 24-week post-therapy, the combination group had higher abstinence rates than the varenicline monotherapy group. The combination group experienced a substantial amount of nausea, sleep disturbances, skin reactions, constipation, and depression, which may explain the loss to follow-up. The second randomized controlled trial was performed in Spain and had 341 participants. Like the last study, one group was given a combination therapy while the other received varenicline and a placebo patch. The difference in this study was that they included each patient's baseline nicotine dependence. At each follow-up, the researchers again surveyed for withdrawals and cravings and looked for exhaled carbon monoxide levels of less than 10. Results were recorded at 8, 12, and 24 weeks post-therapy. Again, each time the combination group yielded higher abstinence rates, but as you can see from the data, the difference is very slight. The researchers went back and compared these numbers with participants' dependency rates, and they found a much greater abstinence rate with combination therapy for those who smoked over 29 cigarettes per day. So they concluded that the results are more applicable to smokers who have a higher dependency. The third study was also a double-blind randomized controlled trial located in England. 117 participants were split into 2 groups, one again receiving the combination of varenicline and nicotine replacement therapy, and the other receiving varenicline and a placebo. At each follow-up, they assessed patients' withdrawal and craving symptoms, and they also looked for an exhaled carbon monoxide measurement of less than 9. Follow-ups were conducted at 24 hours, 1 week, 4 weeks, and 12 weeks post-therapy. At 24 hours, the results were almost identical, but combination therapy showed slightly better abstinence rates at the other follow-ups. The 12-week follow-up for this study was only confirmed by a telephone interview, but still revealed a better abstinence rate for the combination group. The fourth trial was conducted in Japan and consisted of only 35 participants. This study compared nicotine patches alone to varenicline alone. They reassessed patients at 12 and 24 weeks and surveyed for withdrawal symptoms. They looked for exhaled carbon monoxide measurements of less than 8 at the 12-week visit, but they relied on a smoking abstinence questionnaire for the 24-week interview. At both follow-ups, the results showed that nicotine replacement therapy was superior to varenicline, even though the numbers were still close. To keep in mind the adverse effects, in the varenicline group there was a 14-to-1 incidence of GI upset compared to the nicotine group, but the nicotine group had 9 cases of skin allergies. We can conclude from this research that nicotine replacement therapy alone is usually more effective than varenicline. When combined, the effects are slightly enhanced, but they also lead to more adverse effects. In order to get the most valid results, participants need to be followed up at longer intervals, and I think we could benefit from more studies comparing varenicline monotherapy to nicotine replacement monotherapy. Nurse practitioners can work with their patients in community settings to provide screenings and prescribe medications as needed. Not all patients will react the same with each therapy, so it's important for the nurse practitioner to make sure the patients can make informed decisions and get involved with their own care. Because of the negative side effects associated with combination therapy, it may be best to just prescribe one therapy at once or to use small dosing with combination therapy. And this concludes my presentation.